Hey friends, is your current cardiac arrest management up to par in 2022? What does the research in 2022 suggest we should be doing for cardiac arrest patients to improve patient outcomes? And finally, is intubation going away in cardiac arrest management for paramedics? Hey friends, I'm Sean Haaverson, paramedic and educator. And in this video, I wanted to address some of those questions by reviewing a longer video by Dr. Jeffrey Jarvis. Dr. Jarvis is a medical director out of Texas and frequently talks on the current evidence and trends associated with intubation and other topics in prehospital medicine. Now, in this overall video titled from the JEMS 2022 Expo, Evidence for and Against the Use of Advanced Airway Management in Cardiac Arrest, he talks about the use of multiple tools, including airway management techniques, to improve patient outcomes. And his specific goal is to improve long-term patient outcomes by making sure that they are still brain functional and not just focusing on ROSC. Now, to boil down the overall video, this hour-long video, though, is definitely worth your review if you're interested. And anytime you have an opportunity to see Dr. Jarvis present, you definitely should, because he's got just a special way that I'm certainly not going to capture here today. So the bullet points of the items that we can do that he presents at the end of his lecture to improve outcomes in our patients suffering cardiac arrest include some surprising findings and others that we're already likely incorporating. Number one, don't over-focus on airway. Airway is something that might be able to wait. In fact, in some of his studies presented, if we managed the airway too early, we produced poorer outcomes both in and out of the hospital setting in patients with cardiac arrest. If we're going to manage the patient's airway, we may want to provide initially just passive oxygen by a partial non-rebreather and some device like an OPA to splint the patient's airway open temporarily, something akin to pit crew CPR. In fact, while we're providing good compressions, we are certainly providing passive oxygen delivery in that process. If that's not enough, then the next focus would be on BVM. In fact, BVM has been shown to have better outcomes than inserting endotracheal intubation or other advanced airways in some of the recent studies that he presented. If BVM is not enough, then utilizing endotracheal intubation has better outcomes than a supraglottic airway. However, a supraglottic airway would not necessarily produce worse outcomes if that's all you had. When utilizing the BVM, don't overventilate or hyperventilate your patients. Increasing intrathoracic pressure can decrease cerebral perfusion pressure, and that certainly wouldn't help our patient's heart reperfuse. Also, make sure not to delay epi. So while we're not focusing on airway early, we do want to focus on some of those hallmarks, like minimizing interruptions and compressions, providing defibrillation early and adequately, and managing the delivery of epinephrine as soon as possible. In managing patients' airways, make sure that if we have to intubate, there are a couple rules to increase your first pass success. When managing a patient's airway with intubation, make sure that the provider is the most experienced and is well trained. In fact, training frequently is the best way to improve first pass success rates. If you don't have that experience and you're faced with managing a patient's airway, using the supraglottic airway may be better for you than utilizing endotracheal intubation. However, if there's somebody more trained and more experienced with intubation on scene, defer to them to get better patient outcomes. Finally, he does discuss a particular set of devices that can be utilized in addition to this in managing patients' cardiac arrest to improve outcomes. Specifically, that's the use of the ITD device, but it must be used with the ACD device as well. Now, that specific topic deserves a whole new video all on itself. And instead of creating that right now, if you need more information on it, you can look at the link that I provided to a JEMS story that covers the research and ways to utilize the two devices to improve patient outcomes. So again, if you have the opportunity to watch the entire video by Dr. Jarvis, so we're finding that intubation does still have a place in the management of patients with cardiac arrest. However, where in the process is important. In some cases, delaying intubation for the first 6 minutes of care has been shown to improve patient outcomes, while we focus on better compressions and better delivery of the other tools that help us increase survival. I hope this video has been helpful to you, and if you have an opportunity, check out the link for a description and links to the source video if you're interested in the research. All right, everybody, stay safe out there, and we'll talk soon.